We are the Save Disease Lux, and today we are doing an analysis on the fatty liver disease among the Asian Americans with the SAFE score. Our research question is that does the SAFE score, the steatosis-associated fibrosis estimator, can accurately predict lower stages of liver fibrosis in Asians versus non-Hispanic white participants? Although non-alcoholic fatty liver disease may eventually progress to severe disease, it has no clinical symptoms in the beginning. To better predict individuals with lower risk of liver fibrosis, Dr. Kim has developed a non-invasive modality to do so.
For our data analysis, we wanted to get a pool of people who potentially had NAFLD based on their liver fattiness. And we got our data from the NHANES dataset from 2017 to 2018, and we excluded patients with a CAP score lower than 239 decibels per meter. CAP score is a measure of liver fattiness, and thus this is the threshold we use to include those with fatty liver. In addition to this, we only included those greater than 18 years of age, those with complete safe lab values, those without hepatitis B and C, and those who are low-risk alcohol users. Our first main result was studying BMI ranges in patients with NAFLD. For all races other than Asian, prevalence of NAFLD increased with BMI. However, for Asians, there's a higher prevalence of NAFLD in normal and overweight ranges in comparison to other races. This is of interest to us because BMI is an important variable in the SAFE score, and thus we wanted to see if this affected the SAFE score's viability in predicting fatty liver in Asians.
There are different values for the median for the SAFE scores when predicting the lower and the higher risk of liver fibrosis. So we can conclude that the SAFE score is able to differentiate in between the individuals with higher and the lower risk of liver fibrosis. Also, we have done an analysis on the correlation between the SAFE score and the liver fibrosis. From the figure, it may not indicate strong positive correlation, but it is clinically significant. One of the possible explanation is that we are doing our analysis on individuals with fatty liver, but they are not confirmed with NAFLD.
We also performed a logistic regression to show the viability of the SAFE score in all races. For Asians, at a low SAFE score, the model actually worked quite well and had a high probability of predicting low fibrosis. The model appears to work well for all races, except for Hispanic, where the slope seems to be noticeably different. Despite the varying prevalence of potential NAFLD among different races at different BMI ranges, SAFE has a high predictive value for lower stages of fibrosis in Asians. Some limitations we'd like to acknowledge was that there was a high threshold for alcohol exclusion, as well as a lack of information on hepatitis B and C, and a lack of disaggregated data on Asians. Our next steps and opportunities include narrowing our analysis down to the healthy BMI range, which is actually different for Asians and non-Hispanic whites, as well as study the waist to hip circumference ratio and compare its prediction value to BMI. Thank you all so much, and that's the end of our poster presentation.